I've heard a lot of people say that running's bad for your joints, that weightlifting's bad for your joints. What, as an orthopedic surgeon, what's your opinion about this? Like, it's bad for your joints. What does that mean?
Well, that comes from the knowledge that on the end of every bone, like for instance, I don't know if we can see this on the end of this bone.
Yeah, you're holding. What the hell you're holding?
I brought you.
It's like a dinosaur bone.
It kind of is, except it's a femur. It's the longest bone in your body. It goes from your hip to your knee.
Okay.
Right. And so when people break their hip, this is what we're breaking. So if your Aunt Mary fell down and broke her hip, this is the bone that she's breaking.
Okay.
But if we're talking about this question you ask about why people think that running and exercising and lifting is bad for your joints, it comes from the knowledge that, when I had a stem cell lab and we wanted to damage cartilage, which is the smoother than ice glistening end of a bone, all we really had to do is drop a marble on it, as it's very pressure sensitive. That being said, our joints themselves require mobility to be healthy, because the way we feed our joints is through the pressure of the fluid in the joints. It's like,
so it's almost like a rubber. If you've ever seen an old rubber band that gets brittle,
that's like a tendon that gets brittle, right?
So like stretching the rubber band actually keeps it healthy?
It does. Moving muscle, moving joints, lubricating cartilage with mobility keeps everything healthy.
One thing that I want to just reflect on.
Yeah.
Because I think it's a very empowering thing to consider, that we have gotten to a point in evolution or in history where so many of us are not taking care of ourselves because we're optimizing for working more or being at school more or being online more, that we're not spending time doing the things that our bodies are designed to do. And when I listen to you talk about the medicine of mobility, or that movement is medicine, and then I hear you as an orthopedic surgeon and a renowned expert in longevity and in aging in a way that is vital and joyful and powerful and strong, and that's an option for all of us. What I also am hearing is that so many of us buy into the lie that getting frail and slowing down is inevitable.
Yeah.
And then you'll take a pill. And then the pill is meant to address symptoms that you feel. And what I think is very exciting is putting the power back in our hands. And as you're listening to Dr. Wright, she's basically saying your body is actually designed in this extraordinary, glorious way to work for you, to make you feel better, to build muscle, to help you live a full and amazing life. And if you really just consider all the science that you're sharing and the common sense that we'd be built like a mushroom if we were meant to sit, and that your biggest muscles are from the belly button down and you've got legs to move them, or if you're in a wheelchair and you can't move, like you've got arms to roll yourself.
Absolutely.
That when you work with the intelligent design, the intelligent design works with you.
Oh my gosh, I couldn't have said it better.
And so to me, that's a very inspiring thing to be told. You're not broken. You're just not using your body the way it was designed. And if everything aches and you feel like, okay, I've got all this pain, that this is something you can overcome. So if the person listening is thinking, okay, I get this, like this is exciting, and I do have a lot of joint pain.
Yeah.
I do have arthritis.
Yes.
What do I do? Where do I start?
Let's talk about arthritis. And I'm going to give you an example from yesterday of a girlfriend of mine in Lake Nona who was a professional tennis player, but it could be anybody. It doesn't have to be a professional. But through the pounding that she did over her life, she did wear out her cartilage. And so I see this vibrant woman at the peak of her career in exactly what you're saying. She has knee pain and arthritis, and she's not even as old as us. So I could have taken a purely medical route with her. I could have said, okay, I'm going to shoot you up with steroids every few weeks, which I don't do. But I mean, I choose not to treat my patients with that remedy only. I could have said, okay, when you're ready for a total joint, let me know. But knowing that the body will respond with strength to the positive stimuli, we cut out all the inflammatory foods in her life